Welcome to Face Values, the podcast where we peel back the layers of cosmetic surgery and skincare to help you understand how your skin is aging and what you can do about it. I'm Dr. David Jack. I'm a cosmetic doctor and skincare brand founder. I'm based in London. I've got clinics in London and Edinburgh. I've got a real interest in just understanding more about how the skin ages. So I'm going to be joined by lots of guests who are real experts in the field. So I hope you enjoy and keep tuning in. So welcome to Face Values. Today I am joined by Alice Hart-Davis, who is the founder of the Tweakments Guide, which is a book and a website that guides people on all tweakments that are available to man, basically, and women. So Alice's background is in journalism. She started writing about tweakments from the late 90s, so has a huge amount of knowledge on this subject. So today we're going to be discussing what tweakments she rates, what treatments she's tried, and what she thinks the future of tweakments will be. So Alice, welcome to the podcast. Thank you for coming on. So you've got a really illustrious background in the world of tweakments. You coined that phrase, in fact.
Yeah.
And this comes from obviously like a huge background in journalism. You were one of the first people, I guess, to write about tweakments,
Yes.
sort of in various publications.
A long time ago. Yeah.
So how did you get into this in the first place?
By chance, I was working for the Evening Standard and I was writing a lot about health, and the features editor said, you know, there are all these doctors out there who are doing stuff to people's faces. And I said, like, what? What do you mean? She said, well, you know, needles and things, they're injecting stuff. And I don't know. And she said, well, get out there and find out. Uh-huh. So I started, and this was like late 1990s, 1998.
Uh-huh.
And so I started trying to find out, and it was private hospital dermatologists.
Yes.
There were nurses who worked with cosmetic surgeons who would be injecting collagen. Yeah. It was that kind of thing. A few people had toxins, but it was pretty early. But even that early, I could round up people, admittedly in Kensington, who would say, we'd sooner miss our dentist appointment than our Botox jabs.
Uh-huh.
I think, wow. So some people were really quite open about it even then. But now that seems like the dark ages, because now there's so much available. Yeah. But yeah, I've been writing about it since then. Uh-huh. And after a few years, I thought I should try some of these things, because at first, you know, it's terrifying. You look at all this stuff and think, wow, really? People do that? So of course I had friends who were trying toxins treatment. Certainly that was what they were very keen on. But all my younger colleagues would say, oh, imagine injecting poison in your face. Who would ever do that? But then I would have to bite my tongue not to say, look, sweetie, when you're coming up to 40 and you look at those lines, they're not going anywhere, you too would start to wonder, would it be so bad just to try? Uh-huh. So, yeah, I've written about things I've tried, and obviously the older I've got, the more things I've tried and the more treatments have multiplied, the more things there have been to try. Sure. So, yeah, that's kind of how it all came about.
Yeah, and you wrote the Tweakments Guide as well, which is your book, which you published a few years ago, I think.
Yes, it needs an update. I published that 5 years ago now. Uh-huh. And it's one of those things that makes you realise how fast the technology in this area develops, which you know and I know because we're scrabbling to keep up with it the whole time. But in that book, I'm not sure there's more than one mention of radiofrequency microneedling, which has probably now become one of the most popular treatments across the whole aesthetic space.
Yeah. But I have to say that guide and your website are invaluable, as I was saying earlier, particularly if you live out in the sticks like I do. Yeah. Finding the right practitioner and knowing enough about the treatment itself has been really useful. So I thank you for that, Alice, because I've used it personally and recommended it to people, because it's so, for non-clinicians, if you haven't got a friend like David, it's a really confusing world. You may not think that.
Massively.
I don't know.
No, for those of us in it, it's hugely confusing. I'm constantly having to refresh my memory on certain topics before talking about it. You know, the team will say, "Oh, do us a quick video on X," and I'll think, the key points about X are, and I think I better look it up just in case. But yeah, the aim was to try and put down the stuff you'd want your best friend to tell you if they were a doctor or whatever. So, and it's not sensational, it's not that exciting, but the content, but it's straightforward, and I try and keep it as straightforward and independent as I can, so that it just tells people what they need to know. And it's constantly saying, go and ask questions, find a great practitioner, all those things. And it's grown and grown over time. I was told last week there's 3.2 million words on there now, so that you can probably find something about whatever it is you want to know.
No, it's great. Also because it's something that makes us feel so vulnerable.
Oh, yeah, all of us. All of us, even me. Even now, whenever I get on the bed for a treatment, still, there's that moment where I think, is this going to be the one that leaves me with wearing a paper bag on my head for the rest of my days?
Yes.
Because, things can and do go wrong even in the best hands. Yeah. Sometimes. Yeah. Not often, but
Yeah, and you've had some experiences yourself.
Have you?
As have I.
Was something going wrong? Like what, Alice?
The worst one was a treatment. It was a laser treatment. It was being done near the eyes. The protocol, it was nothing wrong with the treatment, but the protocol for using laser around the eyes is to have these metal metal contact lenses, ocular shields, they're called, put into the eye. It's a bit horrible. And I don't know whether there wasn't enough lubrication on them, whether they were left in too long or what. But the net result was they ripped 6 by 8 millimeter patches of epithelium, which is the eyeball skin, off each eyeball, which I didn't realise because there was anaesthetic also in there. And it was the end of the day and we'd been filming, and it was the night we were going into second lockdown. We'd been squeezing in some filming before. And it was agony, and that took a lot of recovering physically, but the shock of it all somehow threw me into some kind of, I don't know, some sort of PTSD. So it sounds mad to say a cosmetic procedure gives you that, but I was basically stuck in bed shaking and finding it very hard to breathe for months. Yeah. Gosh. Which was horrible. And people say, "Oh, what was that procedure?" You think it wasn't a procedure. It was just a really unfortunate thing. And lovely eye surgeons, laser surgeon friends were WhatsApping me whatever I could squint at through these bandage contact lenses I had put in, saying, "Oh my God, we do use those shields the whole time. We have never seen this." So I know it was unlucky. Yeah. But yeah. That was the worst.
And do you, on the guide, do you get many people talking to you or messaging you about complications and things like that?
Increasingly. Yeah. Which is really tricky because they are requiring the sort of help and answers that are way above their pay grade. Somebody recently who had nodules or granulomas or something after a viral infection, a few months after a long-lasting filler made with polycaprolactone, I think. The point about it being a long-lasting filler is that you can't dissolve it like you could. If you get these random lumps that come up later from after a hyaluronic acid-based filler, you can inject it with hyalase, the enzyme that dissolves it, and that may well get rid of it. But this woman, and the poor things, by the time they email me, they will have been through quite a lot. She'd been back to the clinic, who said there wasn't much they could do, or that there wasn't really a problem. You think I could see there were 7 great lumps around her lower face, and
seen a few cases.
She got a lot of social anxiety from that. She had paid privately for a surgical opinion. The surgeon was saying he couldn't dig them out because they were so close to so many nerves. I mean, really awful. And I did a live with Gillian Murray, who she's a brilliant aesthetic educator, a prescriber, practitioner, pharmacist, and she is a co-founder of an organisation called CMAC, which is the Complications in Medical Aesthetics Collaborative, isn't it? And they are a group who gets together, an international group all around the world, and discusses complications. And their conferences are absolutely terrifying to go to. You have all these fantastic people freely discussing awful things that they've seen happening or have been trying to work on. But these things need to be discussed, and they're sharing all the information of how things can be treated. So these things are rare, people. They are not happening the whole time, but things can and do go wrong. And I think the more there are now far more people offering procedures than there ever were. Because of the lack of regulations in the UK, there are far more people who should not be holding a syringe or injecting at all because they're doing it without skill, thought, training, knowledge, awareness of the possible consequences, and I think they are creating a disproportionate number of the problems. But because there's so much more of it going on, I'm hearing more complications. I bet you're seeing a lot.
Yeah, I do. Yeah, from time to time. I have to say a lot of my patients are kind of new to the whole world.
Oh, okay.
But I do see some people who have had permanent fillers. They've got horrible sculptural lumps and things. They've had issues with even hyaluronic acid fillers as well, and then other complications from threads. Actually, that seems to be a big topic. Which
threads is so divisive, isn't it?
Divisive.
You know, this is what I always think would be brilliant.
Yeah.
The thing that does this.
The strings.
So what's wrong with that?
They need to be done really well by somebody who does them so much they can not quite do them in their sleep, but they whisk through them. I used to host the live demonstration stage at one of the aesthetic conferences every year. And there would always be a lot of people demonstrating threads. And the ones who can do it make it look like a beautiful little quick thing they're whisking up, and they can talk clearly and answer questions, take questions from the audience of professionals while they're doing it. The ones who can't, you see them struggling, and it's just awful because if they're not in the right layers of the face, if they're pulling them too tight, there can be so many problems. So I'm really reluctant to suggest threads unless it's with somebody who does them pretty well exclusively.
So can we get into specifics now?
Yeah,
Treatments that Alice recommends in particular. And I know it's a question that you're not keen on, as in blanket recommendations.
Yes. As in, X is a good treatment, Y isn't.
Which treatments are you excited by at the moment? Maybe that's
a good...
Okay, I'm excited by new treatments that seem to offer useful, interesting potential and tackle problems that haven't been easy to treat before. E.g., what I mean is there's an injectable treatment called polynucleotides. Polynucleotides are tiny fragments of fish DNA, the ones that are very popular at the moment. And they appear to have a lot of potential for regenerating the skin. There are lots of brands of them out there. They all seem to be getting great results. But then I go to conferences where people suck their teeth and these professors and say to me, yeah, that was quite a small study, and I'm waiting on it. So it's really difficult to know, but lots of people are excited about that. And why polynucleotides are particularly excited, okay, we'll come back to that in a sec, is because under the eye is a really difficult area to treat. If you stick filler in there, the chances of it going lumpy or sliding off or whatever are really, really relatively high because it's such a mobile area. The ligaments squeeze it, all the filler, and wrap it up. You can use lasers and things, but these injectables seem to be very good at regenerating the skin around there. I haven't tried them. Why do you like them, David?
Well, I do them, and I have tried them on myself, and I think that
You're brilliant.
I've tried literally everything. And I think the nice thing about them is that there is some early evidence. It's not big scale evidence that they can affect melanocyte cell function.
Yes.
They can affect fibroblast function, so they can produce more collagen.
Strengthen the skin, and they take down pigmentation.
Yeah. Right. So they do the two things that are really a struggle around about the eyes to treat. So pigmentation and sort of thin, crepey skin.
Yeah, they strengthen it, and then the blue veins or whatever may be showing through, showing dark circles, are less obvious.
Exactly.
So that seems to be really exciting, and they help with hydration. So everyone's has been very keen on the hyaluronic acid based skin conditioning jabs, e.g. Profilo is one that everyone's heard of. Other brands do much the same thing. And Profilo says that it regenerates the skin and so it's a proper regenerative treatment. And I know you love your Profilo. Polynucleotides seem to add a little something else with special sauce. Other than that.
So I think it's these other cellular
one treatment I tried last year that I did love. There's a great practitioner on Harley Street who will take Profilo and polynucleotides and PRP, blood from your arm, spun down in a centrifuge to you end up with a plasma. It's a platelet-rich plasma. So you got PRP, polynucleotides, Profilo, something else. And then he shoves them all in one syringe, mixes them up, literally like a cocktail, whisks a pico laser, which is a laser. It doesn't work on light. It works more like on sort of sound. So it doesn't drill its way through the skin, but the impact of this laser on the skin is to create millions of tiny vacuoles, which are like tiny little vacuum holes in the skin, which would have a healing effect on its own, a regenerative effect on the skin. You're doing well. Are you still with me? Okay.
Yeah, exactly.
So we have the pico laser, like 7 minutes, millions of vacuoles under the skin, then this cocktail of stuff which has been mixed up, injected around the hairline. It feels like it's running down the inside of your face, fizzing.
Really?
It's like a champagne down the inside of your face, champagne facial. I've seen it called. It is not a facial, it's a very serious procedure. Except it's very easy. You just lie there, whisk a laser around, inject these things, and the mixture of all these regenerative things, the Profilo and the PRP and everything else, goes to work in those vacuoles, and 21 days later you see tightening, brightening, whatever. Oh my goodness.
Amazing.
Yeah.
And you really saw a difference with that?
There was I tried a lesser version of this first, and we measured that one. That was the one we did the pictures on. But because you look at your face every day in the mirror. This is a really difficult thing to tell what's happening, because you look at your face in the mirror and think, it's all right, but is it different? But when you've got those high resolution photographs and you can see there's a bit less of a crease there and this is looking a bit tighter. Okay. Do you mix things up?
I do like sometimes. Yeah. And I've done things with Profilo and polynucleotides together before, but never with PRP as well. So that adds that extra.
Give it a go.
Might as well.
when you got a spare evening.
Yeah, exactly. That's really interesting. It's interesting that you saw a distinct photographic difference with that as well.
Yes.
Which is nice to see with these things, because quite often you do these biostimulation type treatments and it's kind of you think it looks good and stuff. I think with Profilo there's not instant but gratification within a few days because you're nice and hydrated. But the actual regenerative effect
is slow.
So it's
although there's a new product coming out from those guys, isn't there? Which is meant to
we're not allowed
help.
to talk about it yet, apparently.
We're not talking about it.
We're not talking about it.
But products that could regenerate your own fat. In your face. That's very.
Why do I want to regenerate my own fat? I mean, I'm always fighting against it.
But watch out, because you are young, and as you get older, it will
you lose it.
I see, and then you
shrink, or the fat pads flatten and slide. There are 21 or something different
fat pads
in the face, and they shrivel and slide in a plottable sequence, and if they can gather under here, it's really unfortunate. Or you just end up looking gaunt,
jowly bits, and
then you need revolumizing. So particularly under the eye, if you lose the fat under the eye and it's just gone hollow, if you could just a little injection stimulate that to regrow your own fat rather than putting in an extra substance.
Do you find yourself looking at faces in a more kind of distant kind of way now? Like, I'm interested with all the work that you've done over the last 15, 20 years. You look at my face, and are you probably like Dave? I'm sure you do this. You look at people and immediately go, like, have a little think about.
I would to say I didn't. I'm not with you because we've only just met and you've got a lovely face and I'm talking and I'm concentrating on what I'm talking about. But I'm afraid I sit there watching the telly but I'm so fascinated by people's faces, particularly by asymmetric wrinkle patterns. Some people have the most extraordinary.
Strange.
They go diagonal.
And
I can't concentrate on what they're saying.
You're geeks, both of you. That's hilarious.
One of my son's teachers at junior school, I was constantly wanting to ask him questions just to see him.
See how he was.
Because they went diagonally. You think, Mr. Edwards. And he was only about 25.
Oh, really?
Do that again.
Yeah,
so...
Yeah, the
I do,
mechanics.
it's terrible to judging. I try not to be so judging, but
I don't know if it's judging. I would say that you
it's
probably
observation.
It's observation. I don't think it's judgment necessarily.
It's hard not to when you're thinking
but then
about
also
these things all
not
the
to not to put that on people. I mean, you'll know because people come in, you can see all sorts of things about their face, but you have to listen to what their concern is.
Totally. And some people are dead set against doing specific things.
Are
and
they?
you know that
can
one
see-
thing would make more difference than all of the other things combined, but they just don't want to do things.
Interesting.
So, yeah, it's quite interesting.
Do you have to have a sufficient consultation and maybe try other
absolutely,
things to work, get their
and you can I think when people are explained to why that thing would actually be a better option, then sometimes they do kind of warm up to the idea, but sometimes not.
Because the difficulty, if somebody's got an older face, I get these questions from people who say, I went to see one of these doctors, you seem to like this doctor, and they said, and I only wanted my lips done, but they said I should have this and that and the other. I think I'm being upsold. And it's difficult to say, I can't see you down the direct message on Instagram, but I would hazard a guess you are 50 plus and you haven't done anything before to your face and you think what you want is your lips, but in fact there's an awful lot going on. Aging is a multifactorial process and the skin's getting thinner and it's starting to droop, gravity's getting the better of those fat pads and you losing bone mass from your...
Are we?
Yeah, but from your face. Yeah. So from the bony arches of the face, we've got the bony arch across the forehead, the bony arch across the cheeks, and the bone all the way down here. It's all shriveling and shrinking inside our head as we age. Oh my goodness. So the jaw line starts to, shorten and all of these things. So put that all together. There's a lot going on in the face. So that's probably why the practitioner suggested maybe a bit of filler or skin tightening or something. But I also think that practitioner should have found the time to explain to this lady, or maybe she wasn't listening, about how just to do her lips wouldn't give her the overall result she's looking for. And it would be like, it's like painting the front door of a house without bothering to do the rest of the kind of foundational work. Exactly. But of course that gets expensive. And then people are affronted saying, well, I don't want all that. I only wanted this little thing. But if there's quite a lot of work that could be done, what do you do when people want just a little thing? Is there some general skin brightening?
Yeah, if someone do? I think that things like IPL, Profilo are great for that. So it's for people that are maybe slightly reticent about doing Botox or fillers or anything like that. There are these kind of more entry level kind of regenerative things that will always look good on people without much risk. So I think that's a good way to kind of tackle that. And also I talk a lot about skincare with people as well. Skincare is a big thing, and a lot of people come and they've not even tried using some vitamin C or something on their skin. And you're like, well, it'd be good to kind of get into this like just think about your skin for a second. And then
can I just say about this, because you're both going to say this is ridiculous, but I know I'm not the only one. I scrimp on skincare, sorry. I really do, because I then want to spend on a Tweakment. So I can be really lax, shall we say, about my skincare routine.
I'd say you can scrimp on anything as much as you like, but not sunscreen.
Okay.
First, if you're going to use, I would say if people are going to use nothing else, just to use a moisturising sunscreen. And there are some very cheap ones that'll do the job, but you can do so much for your skin with skincare. And where would you say the places are to spend money with skincare? Because I know you have a lovely cleanser, but I think cleanser goes down the drain. A serum in the morning. A good
serum in the morning and a good retinoid.
A good retinoid at night.
And then protection.
And sunscreen.
Sunscreen I know, but
these are the foundations.
But you only have to have those few products: a cleanser, serum in the morning, sunscreen, retinoid at night, probably a moisturiser and for night, but that could be a really cheap moisturiser.
Yes.
And then, because what maddens me is when people say, they'll talk to me about Tweakments, and then I'll say, and how is your skincare? And they say, I love and they name a bunch of high street products, which you think, won't be doing very much. Or they say, what really maddens me is when they say, oh, I like to dabble, as if they were alchemists working up some sort of regime for themselves. And you think, if you want this stuff to do what it claims to do in the ads or what it has the potential to do, you need to use it like medicine. You need to, if it says use it 3 times a week, do that. If it says use it twice a day, do that for at least 6 weeks, and then see if you think it works, and get good pictures before and after. Okay, slight digression, but people who don't do pictures before and after their treatments, that maddens me. I get a lot of, oh, I tried that, it did nothing. I think, did it really? It won't have done nothing. It will have done something, even if you can't.
And it's quite interesting when that happens, and you have taken before. Well, you always have to take before and afters for insurance now.
Oh, do you?
Anyway,
really?
Yeah, you do. But if you compare, if they come in, they're like, I don't see any change, and then you show them their before picture and compare it to now, and there's a massive change often. And then I think because people have been looking at their faces day in, day out in the mirror. Don't see really what's happened, and then it's quite obvious when you actually you take the 2 pictures and compare them. So
or people come in with selfies and whatever and say, doctor, I don't look like this anymore,
and like, in like bright studio lighting and like on holiday when they're nice and relaxed.
I do think Insta culture has really not helped with all of this. I mean, I didn't recognise somebody recently, and I only ever met them. I'd only ever spoken to them on Instagram. And I suddenly realised, because look, we all do it. We all take the most flattering.
Look like.
Oh yes, this is what you.
It's like byline pictures for journalists in magazines or whatever. It's a great joke for how few people actually you can be recognised from them.
Yeah, I can imagine.
So Alice, you mentioned polynucleotides. You think that's going to be a nice big new kind of topic, this regenerative medicine thing? Anything else that you think is where do you think the future is going in aesthetics? What
I think it's I would like to think it's treatments that aren't so invasive but that cumulatively have bigger results. There's nothing specific I'm talking about now. It's just that people seem to be quite off the idea of big procedures. I'm constantly asked about barcode lip lines.
Sure, yes,
what's the best thing? And I say, well, savage laser, but most people are not really up for that. So if there was some treatment that you can, and I get lots of people saying, what skincare will get rid of my barcode lip lines? And you think it won't. I mean, a good retinoid will be great, but it's not gonna really do the business. To really get rid of them, you need to laser them right down. So the laser guys describe it beautifully by saying you can either drill holes with the laser, like aerating the lawn, and then the skin regenerates itself, or you can use that laser to mow the lawn and simply wipe away those wrinkles. Obviously you need to know when to stop. So and then it'll be months to see how much the collagen can renew. So things like that, because other procedures I've found have a huge impact. Things like fat transfer to the face, but that involves liposuction to get the fat. It involves mincing up the fat then and there to get it into enough of a consistency to inject. Using some of that fat to create a sort of stem cell broth. You can extract stem cells from your own fat, which when you then use the fat like you would a filler to contour the face, fat will only a certain proportion of the fat will last or will take in that new position. It's got to grow blood vessels through it. So you have to overcorrect with fat because you're going to lose 30-40% of it as time goes on, but you can enhance the chances of that fat surviving by using a stem cell broth made from your own fat things. And I had all that done 4 or 5 years ago, which was fab. Though I looked very strong. Your face looks very strong, said one practitioner who I saw a couple of weeks later. He was trying to be polite. And that was as far as he could go towards saying, but then he leaned in and said, oh, they missed a little bit. Just oh no. Thank you. There's me trying to feel great about this thing. So it would be procedures that can give a great results without so much. I don't know what it's going to be.
And do you think as many people on that note are doing larger procedures like surgery and deep plane facelifts and things now, because there's so much on Instagram and things, and so many surgeons putting lots of before and afters that are so dramatic. Do you think that has increased, or just awareness has increased?
I think it's just the awareness of it, because I mean the deep plane technique has actually been around for quite a long time, but it's just been popularised, like you say, by Instagram.
Yeah.
It does often seem to give lovelier, softer results depending on whose hands it's in.
Yeah.
It's a way of kind of untethering all the layers of the face rather than just peeling back certain layers and tightening up the muscular layer. They sort of loosen all the ligaments and just move the whole face up as well.
So it's a facelift.
It's a really fun, deep facelift. But done nicely, the recovery can be quite quick and the results look lovely and quite natural. But yeah, that's where you get the big transformation. And most people aren't ever going to step up for cosmetic surgery. It's just, across the whole sort of population, most people say that is far too much, but they like the idea of a tweakment. But in their mind, they build up the fact that a tweakment might well give them the result of a facelift.
Yes, yeah.
And that's where it's huge difficulty for you.
Do they do? Yeah.
Sometimes.
Oh,
and
a lot to
it's
manage.
a lot of managing expectations, I guess. But
because we all go around talking about things that will tighten jawlines or skin or whatever, and they can do these things to a certain degree, but it all depends on the person. And I mean, picking your patient is the key thing, isn't it, for any procedure? So all these people who message me saying, should I have this thing? Should I have that thing? You think, I don't know. Plus, I can't see you. But even if I could, I'm not a doctor. And you need to sit down in front of a great surgeon, nurse, dermatologist, doctor who can assess your face and say, actually, given the way you're presenting, you think you want this, but what could be helpful is that. Now go away and think about it.
Yes. I wonder if there are enough clinicians like that, do you think?
The good ones.
Yeah.
But the vast majority of people, so many people, you'll get this from the people who are coming in with problems. They say to me, oh, I know I should have gone and seen somebody who knows what they're doing, but there was this offer, or there was this new person, my friend said she was really good. And now there's a problem.
Party or something.
Yeah. God, do they still happen?
Yes.
Yeah.
Oh, no. It's amazing what risks people will take, like with their face. I would rather, if I just couldn't.
It's just a little bit of whatever. You think it isn't. It's a cosmetic results, but these are cosmetic medical procedures, and they need to be taken seriously.
I would rather just not do anything if I can't afford it. I'd rather just not do it than if I can't do it with the right person.
I think things are slowly changing. I think there's more legislation hopefully coming and things to protect against these things. A lot of the kind of discounty chains, I noticed another one today that has gone into liquidation.
Oh really?
So it seems to be. So I think that things are slowly kind of coming around a bit in favour of quality treatments and practitioners who know what they're doing and things. So hopefully that's maybe what the future holds for the industry.
That is the answer I give most often to any question. Just find a good practitioner, get their advice.
Yeah, and you have your list of practitioners on the
we do.
Well.
We have a great big list of
in there.
practitioners who he's one of the first, so thank you, found a member joiner, just because that's the place to start. And there are good people all around the country. It's not just London. There's a disproportionate number of people in London, but to start with somebody who really knows what they're doing and to take it slowly and build up a relationship ideally with that practitioner. I'm always have got questions coming in from people saying, you say no doctor hopping, but then you go and have all these different procedures with different people. I think, well, that's my job, and that's I don't do these things completely uninformed. Even the things that go wrong, this will be somebody who has a certain amount of expertise, has done this thing a certain number of times, and I want to go and see them because, and also it's fascinating because everybody does treatments in a slightly different way. Even with something as basic as toxin, they use different concentrations. They prefer different ways of balancing. It's all about balancing the face. It's not just about freezing lines. It's all about working out where a person's asymmetries are and addressing those. So, yeah.
Great. Well, thank you very much, Alice. That was really lovely and informative, and a pleasure to speak to you.
Absolutely delighted.
So how can people get in touch with you if they want to?
They can
Instagram,
find
website.
me on Instagram, the Tweakments Guide on Instagram, or my own channel, which is Alice Hart-Davis on Instagram. And the Tweakments Guide website is there. But yeah, if you put Alice Tweakments into any good search engine,
you'll definitely come up
with a list of scary features I've written for some of the papers about some of the things I've tried.
And there is probably, I don't know how many thousand articles that you've written for other...
A number.
Yes. Yeah. Other newspapers and
some
websites and things.
Yeah, have quite extravagant headlines, but there's good ones. I did a good one last year. I had an MRI to see how much filler there was in my face after 4 years since the last treatment, because everybody thinks it'll go after 6 months. Anyway, there was quite a lot, and that one went far and wide.
Yes, that was.
But it did have a slightly misleading headline on it. It said, "I've got 20 years of filler stuck in my face," which wasn't actually true. But I never get to see the headline before it goes. But and then lots of doctors sort of said, "Well, that's ridiculous. Hyaluronic acid fillers dissolve after however many months," and you think. And that's what the whole filler industry is sort of predicated on. You think, well, yeah, but this is my face. This is an MRI.
It's an MRI scan.
I can't argue with that.
This is an expert who analysed it.
Clinically, you do see that. You see after years that people still have some filler left in certain places.
In some people, yeah.
Some people, everybody's slightly different. And the final question that I always ask people is, if you had one treatment that you could do, and you could only do one, which would it be?
I've got a very long answer to this.
Yeah, go for it. Go for it.
The difficult thing is, I love toxin. It might be that because I grind my teeth. And even if I had to have all the wrinkles on my face to have the grinding, you can have these muscles injected, the big masseter chewing muscles, and it... So that would be great. I love filler because of the way it just... I've got the kind of face that goes hollow with age, and it softens and it contours. And I don't know really whether I should put both of those aside and just think about something like laser, because if you only had regular lasering, it would take up pigmentation. And actually, when we look at a face, there's been a lot of research to show that it's not the wrinkles our eyes are counting subconsciously. From a sort of evolutionary perspective, we're looking at how much pigmentation and weathering there is. That's how we detect age. So if you've got laser knocking back your pigmentation, and it'll keep your skin nice and tight, and it'll renew the skin from the inside out. So
I love this answer. You can tell Alice is an expert because she doesn't just give us one word.
I can't decide. Laser would be... Laser would be good, but I know because of the amount of neck pain and everything else it causes me when I wake up at night, hanging onto the bite plate that I've got to stop me grinding. I would be reluctant not to have that.
Yeah, and one skincare product, if you were running out in, say, an emergency or something, you grab one SPF. Good answer.
And if it's got to be a bargain one, Altruist. Yours SPF is lovely. Altruist is like you can get a litre of it for about 30 quid.
A litre of mine would be about
£1,000. We need it.
Good to know, Alice.
Great, Alice. Thank you so much for that.
David, you're so welcome.
It's
always a
lovely.
pleasure talking with you.
Likewise, thank you. So that was Alice Hart-Davis, the founder of the Tweakments Guide. You can find her information at the Tweakments Guide or on her website, which you can Google. If you enjoyed this podcast, then don't forget to subscribe on whichever platform you listen to this on. And you can find me on Instagram at Dr. David Jack, and my website is drdavidjack.com.